there we have externus abdominis, runs like this. Internal abdominis runs like this. Transversus abdominis runs like this. And the rectus sheath is here, and the muscle runs like this. Okay. Then we just practiced for the transversus and the obliquus externus, external and internal oblique. When we treat in this area the iliacus, the psoas, we treat them together with mentioned with the muscles I spoke about. And if we have a problem here at the iliacus, as I showed, to differentiate, we have then to lift, to come up, that the muscle is activated, and then I can decide it's a problem in the superficial or in the deeper layer. So we work in everyday practice. What we haven't practiced is the rectus. Please lift your head. Then I can feel where is the border of this rectus sheath. Huh? And then there are many possibilities. How is it the situation? Sometimes it's very tense, sometimes there is no tension at all, and you have to look. It should be possible to press a little bit in this direction here. This works well. If it's too deep, without tension in the muscle, then I have to say, please lift your head. And then there is a little tension in the muscle, and then I can provoke the muscle. It's important here to examine these different regions, and then you will find these areas with pain recognition. Okay. Then we have the intercostal muscles. They are a continuation of this external and internal oblique, and I can go here between the ribs, and easiest way is here to go between the ribs with one finger. With the other hand I can press, and then I have like the wooden tool, something to press inside and to see if is it possible to get pain recognition. Okay, this I can, the space a little bit bigger if you go with this hand behind the head, and you make a lateral flexion of the body. Exactly. Now I have more space, and so I can perform the examination of this intercostal space. For this part, it's comfortable to lay on the back. For the rest, it's better to lay on the side. This is clear.
여기까지 혹시 다 캐치 하시죠?
It's okay? Great.
너무나던데.
몇몇 분들이 제 눈을 자꾸 마주치고.
Okay, please come back. Then, for the diaphragm, I can go here at the lower border of the thorax, and I feel the ribs. And with 2 or 3 fingers, I go around the ribs, and I try to reach the inner part of the ribs. I go slowly, and in this phase of the examination, it's not a treatment of the diaphragm. Now it's a stretching of the abdominal muscles of all 3 sheaths, external, internal, oblique, and transversus abdominis, and it's an exquisite treatment for the abdominals so far. If I want now to reach the diaphragm, I have to go inside and then to press the inner part of the ribs, and just in this moment there is a provocation of the diaphragm. But in this moment, no provocation at all of the diaphragm. So I'll takes a little time. I go confluent with the rhythm of the breath to enter here deeper and deeper. And then I keep my fingers, and you see the difference. It's okay?
Yeah.
Yeah. And so I can reach a little part of the diaphragm, not a big part, but at least this little part. Okay, so I go inside and then I press from inside here. For you, is it more comfortable with in this situation or in this situation without this hand?
뭐가 더 편하죠?
This or this? This. Most patients, they like to have here the resistance, but there are patients, it's too much for them, they don't like it. So I perform both possibilities and I ask, and for most it's more comfortable if I practice it like this. Okay, on your left side, please. Oh, not on your back side. I forgot. No, once again, back. I forgot one thing. Because most often I can reach one part of the abdomen. You can see very well. Lob. This is just rectus. No, it's just external oblique of the abdominal muscles, and this is very well to find just one part of the muscle, because when I press like this there are other structures also involved, but now this is just the oblique external oblique. And for acute lumbago, often the trigger points are in this region, so it's comfortable to reach here locally like this and to know there is a problem or there is no problem. Okay, please try to reach this. But if you don't get it, then call me. I will show you often I can produce this. Okay, now on your left side. Here we can continue with the treatment of the intercostal muscles. It's very, very easy. Huh? It's very, very easy. If I'm here, please go with the hand to the neck. And you can turn a little bit like this and back. And so I can perform which technique? 2B, exactly. Okay. Same for the abdominal muscles. I can go in pre-stretch like this. Excuse me, this leg forward, and the knee rests in contact with the bed, and you open now. And now I have a pre-stretch for the external oblique, and so I can make here this facial stretching technique to find trigger points and to release this region. It's okay?
Yes.
Okay. And the other part we did together with quadratus lumborum, as I showed. Okay. So please, on back side, then on the side.
더 오시.
5 to 6 minutes to